Well, where we are right now in healthcare reform is that both the House and the Senate have passed final bills that would move us towards healthcare reform in the United States. In many respects, the legislation is very similar. Both of them eliminate underwriting based on health status, pre-existing conditions clauses, exclusions, require insurers to take all comers. Both of them include an individual mandate requiring everyone to purchase insurance, because once you say insurers have to take all comers, then you have to make sure that they have a good risk pool to deal with, that they don't just get the sick people. Both of them include an employer mandate, although it's clearer in the House bill than in the Senate bill, but both of them would more or less require employers to provide health insurance for their employees. Both of them include exchanges, which are markets to make health insurance competition work better among insurers, hopefully bring down prices, but also give people better choices, more choices. And finally, both of them include subsidies to help people, lower income and middle class people, afford health insurance who don't get it through their work, and also Medicaid expansions to help cover the poor people. The bills are also quite different in some significant respects. The way in which the bills are financed is very different between the House and the Senate. The subsidies are somewhat different. The Senate is more generous to higher income people, the House more generous to lower income people. One thing that I in particular have been very concerned about is that the House bill calls for national health insurance reform. The Senate bill would require the states to each pass legislation to reform health insurance. There's no simple way to reform health care. Health care is just too complicated. We have a sixth of the U.S. economy. It's something that affects every individual in the United States in an immediate and personal way. You have very powerful special interests that are affected by healthcare, the insurers, the pharmaceutical companies, the biotech companies, the doctors, the hospitals. Everybody believes that they're special and that they deserve special treatment. So it's inevitably going to be very, very complicated. And the legislation is complicated. It's not impossibly complicated. It's complicated. The problem has been that it has been too complicated for most Americans to understand. And Americans across the political spectrum have gotten confused. And at this point, I think that there are some people have been intentionally misinformed as to what's in the legislation. I think that's a real problem. The media has done a terrible job of covering healthcare reform. They've been much more interested in the process, in the politics, very little interest in the content. And when they have gotten into the content, they've often gotten it wrong. It's a wonder anybody still supports healthcare reform, because I think there are very few people who understand what the law does or would try to do.